I really like the weight loss injections, Ozempic, Wegovy, Mounjaro, Zepbound. I think they are like a game changer for so many people, especially those people who've been struggling with weight, maybe from their teenage years, from childhood, those who are thinking, well, why is it that, I seem to gain weight, but my friends don't? And that's because these GLP-1s, glucagon-like peptide weight loss injections, we have these receptors all over our body, but the ones that we're really sort of talking about are the ones in our gut. Because what they do is they send signals to our brain to say, you're full, and also work on the pancreas to help increase insulin secretion. So for many people, especially those women in perimenopause and menopause, maybe who are experiencing metabolic disorder and finding that weight, and what that means is that weight distribution is just around the middle, they're really struggling with weight. They're not able to shift it with the usual things that they used to do, maybe cutting out carbs, maybe exercising more, cutting down on alcohol. So I really love them because I think that they can really assist and help with the weight loss journey, and also from the point of view of hormonal balance, also from the point of view of helping with your metabolism and metabolic dysfunction that occurs in midlife. I think that really, for me, they should be something that should be considered as part of the perimenopause and menopause sort of woman's toolkit alongside her HRT and testosterone. And that's what I do personally, and that's what I also do with my patients in clinic. What we tend to do is to start people off on their hormone replacement therapy, their HRT journey. For most women that come in, we start off initially with that, get the balance of hormones right, add in some testosterone, and then consider the weight loss injections. My favorite, or my personal favorite, is Mounjaro, because studies show that over the course of the year you lose about 20% weight compared to things like Ozempic and Wegovy, where it's 15%. But it's really not about the percentages. That's not the real reason why I really like it. It's because Mounjaro consists of two hormones, GLP-1 and GIP, and tends to have less side effects. And side effects can be quite severe for some patients. Side effects can be nausea, vomiting, acid reflux, belching, and things that you might not have heard so much about are things like a fast heart rate, that tachycardia, palpitations, headaches as well, constipation, bloating. And we know bloating is already a symptom that many women experience in perimenopause and menopause, so it can potentially make it worse. So it's really about weighing up the benefits for each woman versus maybe the potential sort of risks and adverse effects. Some of the serious side effects are things like pancreatitis, which is, this severe abdominal pain that you could feel, gallstones, increased risk of thyroid cancer. Now, my personal way of prescribing it and the way that I have been taking it for myself is microdosing. And microdosing means that you're using it at a lower dose than maybe that is usually prescribed. You're taking it for a lower dose for a longer period of time. And this enables and allows, to minimize the side effects, but it also allows you to adjust the dose for each particular person. So we don't really have to rapidly go up the dosage. The things that people sort of worry about a lot are things like hair loss and muscle loss or muscle wastage. And you might have heard a lot of scare stories about it. With any diet or with any rapid weight loss, you will find that you will lose hair. And that's why microdosing can help by doing it in a more slow and steady way, the weight loss, so that we can minimize that sort of side effect. The other thing is with muscle loss, whenever you lose weight, irrespective of which diet you're on, you will lose some muscle as well as fat. And my concerns are really more about yo-yo dieting. And that's why, I think that it's important that this weight loss journey isn't done in 2-3 months, but it's probably more done in sort of 12 to 24 months. In clinic, we monitor every month initially, maybe for the first 2 or 3 months, and then maybe every 2 to 3 months, depending on each person and her needs. So, from a pricing point of view, the initial consultation, if you're not already a patient, is about £395, and that covers, sort of looking at your hormones, your weight, looking at your history, understanding what your needs are, why you've been struggling with weight loss. Is it because, you've gained weight because you're a comfort eater or a stress eater, a grazer? Is it that you're eating the wrong foods? You're just focusing on calories calories rather than the content of those calories. And that partly is a problem of, sort of the Gen X and the early millennials, because we often got just taught that it was just about calories, but not looking at the content of calories and not understanding why the content of the calories are really important, not understanding things like insulin resistance, not understanding the role of stress hormones, cortisol. So you start off with your initial consultation, and ideally we like to do a blood test, or if you've had a blood test done in the last 3 months, then that's good enough. And then you check in on a monthly basis. And then we do what was called a short monthly consultation, which is £155. And so you may do that for the first sort of 2-3 months. Some people may need longer. When we get to sort of a more sort of comfortable, steady state, it may be every 2 to 3 months. Often the first month is the most scariest for most, because you have to inject yourself every week, and that might be a new thing for you. And some people may have fear of needles, may not understand how to use the pen. So there can be a lot of sort of anticipatory anxiety around the initial dosage. And when we do it like this, when we go a bit more slow and steady, you tend to find you don't really get those side effects of muscle wastage or hair thinning, hair loss, or when people talk about Ozempic face, that loss of sort of fat from your face. Obviously you will lose weight from there, but it won't be in that rapid way. And considering perimenopause and menopause, there's that loss of collagen and elastin. We don't want that weight loss to happen really rapidly, particularly from our faces. So it really helps with those metabolic disturbances, helps to improve the sort of cholesterol lipid profile, reduces your risk of pre-diabetes. I, for one, do think that it should be something considered as part of the sort of midlife longevity health optimization regime. So, you have your estrogen, progesterone, testosterone, and your low dose weight loss injections. And that's precisely what I do for me. And I think, it really does help with mood, energy, but most of all, I think one of the big things I found that it's really helped with is that horrible food noise, that sort of gnawing away noise, all those cravings, that sort of are almost like you're feeling like an addict, like a junkie. What really annoys me is these sort of scare stories that you'll see in the press. somebody's been vomiting, somebody's had some really bad side effects. And I think that's because maybe they've been buying it from unregulated sources, or from, sort of pharmacies that aren't monitoring or supervising them. And maybe they're rushing up the sort of stepwise increase in dose. And so for me, I'm very keen to almost like set the record straight, because I think these are, sort of real game-changing medication for so many people. We know that obesity kills so many people. It's a massive risk factor for heart disease, for cancers. So, when prescribed correctly and at the right doses, when they're monitored and supervised, these can be real game changers for so many women. So I really want to put that record straight. If this is something that you really have been thinking about, or you want to know more about, add your comments below, any thoughts that you may have, any queries you may have, and also don't forget to subscribe.